Hi, this is Dr. Nemechek. Excuse me, got to get my caffeine going here. Dr. Nemechek, the Nemechek Protocol in Buckeye, Arizona. And a common question that people ask me is, how long do we need to do this? Is this forever? Well, one, nobody lives forever, so obviously not. But each component has its own little timeline. All right? Now, and this applies to both adults and kids. Let's say the olive oil, right? The need for the olive oil is a function of the food supply. It blocks the toxic effects of this high concentrations of linoleic acid we're getting, of some saturated fats like palmitic acid, all right? And as long as those elements are in high concentrations in the food supply, we're going to need olive oil. I don't see any big concern about these vegetable oils right now from a medical public health standpoint. So I'm prepared to do it for the next 20 years. Okay, now maybe things will change and they'll say, okay, we're going to get rid of these toxic things, but then you have to worry about what else are we putting in their place. So it creates a mess. So the olive oil aspect of my protocol is probably going to be for 2-3 decades maybe, okay? The gut bacteria issue. All right, so we have like 1,100 species of bacteria, and one of the big hurdles in research right now is we don't know how to grow 80 to 90% of the things. It's very, very difficult to study, where there's lots and lots of work being done on this at a very sophisticated level, and what we need to do, because everybody worldwide has lost a bunch of species, okay? And so what we need to do is figure out how do we prevent the loss, so maybe change the way we give antibiotics, because, for instance, we're learning that if you have a bad sinus infection and you give somebody an injection of antibiotics, so you bypass the intestinal tract for the most part, it doesn't seem to damage the gut, all right, as compared to if you swallow the antibiotics and they're in full force right in the intestinal tract. So there'll be some ways we can at least prevent it from getting worse. I think fecal transplantation will increase, and we'll find different niches where it's useful in people. But then how do you repopulate to this normal blend that we think we should have? And we kind of know what that blend should be, but it's just that we can't grow the stuff, And so I'm thinking, so the kids are going to need to stay on inulin up until the teens, and when it quits working somewhere in the mid-teens. And then the rest of us are going to need, a round of rifaximin, Xifaxan, Rifagut, whatever they call it, rifaxamina in your country. Those are all names for the same thing. And in the adults, we now routinely will repeat the round every 18 months. Because what I find, if you relapse from antibiotics or some medical procedure causes your gut to relapse, that's one thing. But say you haven't had anything done to you, that we have a very high proportion of people relapse spontaneously between 18 and 24 months. And I think the spontaneous relapse is probably because of our depleted number of species we have, or what's called low biodiversity. So rifaximin, very safe drug, doesn't get in the bloodstream, almost zero drug interactions, does not deplete your species count. I'm planning on taking it every 18 months until there's some way to boost my gut bacteria. I think that's going to be 15, 20 years off. All right? And then the third aspect are these prime microglia that develop in the brain. Those are the white blood cells that normally repair things and prune your neurons, yet turn into this permanent population of inflammatory microglia or white blood cells in the brain, all right? And we're now understanding these are responsible for a wide variety of neurological conditions like Parkinson's and Alzheimer's and PTSD and schizophrenia and Alzheimer's, autism and CTE, severe epilepsy, a whole host of things caused by the same problem. Now, when these prime microglia are formed, unfortunately, they become immortal. They'll never die, we believe, our entire lifespan. So that's a big problem. So we got a twofold thing here. The fish oil that we use and the vagal stimulation we use in some patients will cause the inflammatory microglia to behave. They become anti-inflammatory and actually seem to engage in a repair process. So we can hold them there, all right? But how long is that going to be? Well, up until recently, I was saying, I have no idea. But there's been a little breakthrough, I think, this summer that has actually got me quite excited. These microglia outside of the brain are called macrophages, and they're white blood cells that live in the tissue that kind of help clean things up, so to speak. And they can, on occasion, form a type of leukemia, a cancer. Now, we have some chemotherapy drugs that are targeted against these macrophages that also work against the microglia in the brain. Now, so they did this study recently. They took mice who had a brain injury, but the mice also had bad bacteria. They had these prime microglia that are there permanently. So you have a mouse that's not functioning well. He can't remember his food maze and his balance is off or something like that. Some way they can detect the brain's not working. And they give this mouse chemotherapy to make the microglia go away. All right? And then once they gave it for a certain period of time, when they stopped the medication, the microglia came back because the body wants to replenish these cells. The body wants to have a certain number of these cells to remain in the brain. But when they came back, they did not come back as these damaging inflammatory ones. They came back as very healthy, normal microglia that then engaged in a repair process, and the mouse brain recovered. So not only can you make these inflammatory microglia go away, but when they repopulate, they fix the brain. Now the problem is, right now, is this is a chemotherapy drug and it's way too toxic, all right? It's far safer to use some fish oil, maybe some vagal stimulation until we figure out how to fix that. Now some people say, well, how long is this? Well, you know, most of you know I'm an ex-HIV clinician and researcher, and our first drug in HIV was AZT. It was actually looked at. It was a chemotherapy compound. It was effective, but very toxic, okay? But we knew it could help. We knew it did the things we needed it to do to actually make a patient feel better. Now, the thing here is, within about 8 years of AZT starting to be used, we had 4 to 5 other drugs that worked very well and were doing the same thing. Within 10 years, I think I probably had 8, all right? There's a lot of money to be made by the pharmaceutical company in this, and I know that's a whole nother thing that gets people upset, but the point is, they're the ones who fund clinical research. They are going to dump a ton of money into this thing, and they're going to find an answer, because when somebody does this answer, that answer meaning of making these prime microglia, which are damaging, to go away and be replaced by healthy microglia that will repair the brain, this drug or therapy or whatever it ends up being, okay, could be used potentially in Alzheimer's, Parkinson's, Lou Gehrig's disease, all forms of dementia, severe epilepsy, PTSD, chronic depression, schizophrenia, bipolarism, CTE in football players, and autism. Awesome. So it might only be 10 years for us to need to use these high doses of fish oil and the vagal stimulation, okay, before we have a drug that's safe, predictable, okay, and can do the job, and maybe even do the job a little better. So that's my outlook on the gut bacteria, the fish oil, and the olive oil. Like, how long do we need to do these things? Certainly not forever. Some are a long time, but it'll be here before you know it. All right, that's all. This is Dr. Nemechek, the Nemechek Protocol in sunny Buckeye, Arizona. Y'all have a great day. Bye-bye.